By bringing light into a difficult time, the Hospice and Home Health Fund of Alabama gives hope to homebound patients with debilitating or life-threatening medical conditions. The Hospice and Home Health Fund of Alabama was founded in 1990 with the support of Charles D. Beard, his wife Mary Sue Beard, and John Beard, president of Alacare Home Health and Hospice. The fund was formed as a way to help patients using home health or hospice services who have monetary restrictions that may keep them from receiving care in their home.
The Hospice and Home Health Fund started as an outreach effort by my father, Charles D. Beard Jr., and my mother, Mary Sue Beard, to assist our clinical staff who were out in the field seeing patients. When our nurses and home care aides and therapists would run across individuals that didn't have the resources for their medications, to do simple house repairs. In other words, when the nurses couldn't get into the house because the steps had collapsed, or they were literally going to fall through the porch to get in there, or hot water heaters were out, or patients couldn't breathe during the hot summer because they had no air conditioning. He saw a need to do something as an organization to help our clinical staff who were taking money out of their own pockets. Oftentimes, they didn't have a large income, and they were sacrificially giving for the patients to be able to stay home and have the needed resources they needed. So as a result, he got the Hospice and Home Health Fund going forward with my mom, and our social workers were highly involved in that. And we asked everybody to make a weekly contribution out of their pay so that our clinical staff who were faced with these severe problems for these patients, where there were no other resources in the community, would have a pool of money to draw out of, and they wouldn't be taking funds out of their own pocket.
An Alacare hospice patient with cancer is living in a rural area. After working hard his entire life, he and his wife receive assistance from their church and the Hospice and Home Health Fund of Alabama.
That air conditioner, we couldn't breathe without it. It's just been incredible, and then of course the floor is just it's just lifted us up. We've never had much, and so it really wasn't something that we would have asked for, but just knowing that someone cared enough to want to do that for us, it's just almost more than we can understand, really. And it's just it's just more help than we can comprehend. It really is. I've told the children for the first time in their life that they might have to take their shoes off before they come in.
By providing such things as medical equipment, prescription medicine, home repair, food, and utilities, the fund can help meet basic needs.
We're always very, very grateful for the donations that are made by family members or former patients, or for those patients who have died under hospice services, memorial gifts and all that. So it's a combination of those sorts of three things. The foundation, of course, has always been giving by our staff into that fund, then coupled together with gifts from patients or families or friends as memorials or just gifts of gratitude into that. And then finally, going out and seeking money from other charitable organizations to help support some of